Welcome, my brother. Thank you very much. Welcome. Thank you very much. Hello, how are you? Thank you.
Even as we speak to collaborate and as we seek to collaborate and forge partnership to develop our vaccine production capacity, we must not lose sight of our fundamental strategic goal, which is the achievement of vaccine and healthcare sovereignty. Africa must therefore begin to liberate itself from the dependency on donor-funded mechanisms, and AU member states must significantly accelerate efforts to develop a self-reliant, self-sufficient vaccine production sector for sustainable access to routine as well as outbreak vaccinations. In turn, it is necessary for African leaders to mobilize adequate investment in local vaccine industries, which entail the removal of drawbacks, including intellectual property obstacles to manufacturing, trade barriers, and supply chain constraints. We must also promote equitable vaccine distribution globally based on the need to save lives, not greed for profit. The time has come for the African Union member states to take bold and decisive steps in implementing homegrown solutions to our health security challenges. As regards vaccines, we must build a holistic ecosystem incorporating the entire value chain all the way from research and development to clinical trials, local production, as well as efficient distribution and delivery. Kenya is committed to working in close collaboration with our valued partners, including the Africa Union Commission, Africa CDC, the Africa Medicines Agency, the World Health Organization, IVI, and other regional and international stakeholders. As members of the Africa Union, we must seize this opportunity to accelerate and create an enabling environment for vaccine manufacturing in our continent by mobilizing adequate resources, sharing knowledge, expertise, technology, and also sharing best practice. We already have a special economic zone that is going to provide the necessary environment for pharmaceutical companies who want to set up. And I want to ask those in this room and elsewhere who are looking for an opportunity that there exists an opportunity for a $1 billion market in Kenya and possibly a $50 billion market in Africa. And you have an opportunity to set this up in Kenya. We have a special economic zone ready that you can manufacture for local consumption in Kenya and for our region. Again, realizing the importance of us building the capabilities and the necessary environment for us to produce pharmaceutical products locally.
Indeed, the success of vaccine manufacturing initiative is predicated on a regional approach to ensure sustainability and supporting the continental harmonization of efforts in the areas of regulatory affairs, research and development, and most importantly, the workforce development that is required. I welcome you all to this side event with the hope that the commitment by our heads of states and government will amplify the rallying call for vaccine manufacturing capacity through building end-to-end project-driven vaccine initiatives while emphasizing the need for a self-sufficient and sustainable vaccine ecosystem in Africa.